Today's topic that we're going to talk about is trach care and troubleshooting trach cares, whether it be at home or in a hospital setting. So this video is intended for nursing students, new nurses, new respiratory therapists, and family taking patients home that are coming home with a long-term trach situation. So the first thing before any type of trach care or medical procedure is to gather your supplies. The supplies we have here are a trach care kit, which includes everything you will need for cleaning a trach, split sponge to absorb secretions, a trach tie to hold the trach in place, a 10 cc syringe to inflate the cuff, clean or sterile Q-tips, and this is the part of the actual trach that is within the patient. So the part of the trach that we will be watching, this is the actual airway within the trachea. On the airway you will see we have a cuff that can inflate or deflate depending on needs, the flange which holds the airway around the neck, and the pilot balloon which allows us to inflate or deflate the cuff. Within the actual trach we have an inner cannula that is frequently changed to allow for keeping the airway clean, prevent any type of secretion buildup, and how it works is you find the appropriate size, it sticks in the trach, and then there are flanges that you pinch to lock the inner cannula into place, like so. This then you squeeze out to remove, and depending on the trach available, it is either cleaned with sterile water until it's clean, or else thrown away and replaced with a brand new one. Another piece you might often see is what is called an obturator. What this is for situations of either the initial placement of the trach, or else if a trach comes out of the patient to place it back in, it goes within the trach and creates a smooth guide, and it makes the trach firm to allow for guidance into the trachea. So we will begin with trach care. Now that we've covered all of our equipment. The trach within the patient sits in the airway. The cuff is manipulated with a syringe. To add air to the cuff, you add air to the syringe, put it onto the pilot balloon, and add air. What is happening in the airway, that you can see here, I'm adding air, and air is added to the cuff. In reverse, take air out, the cuff shrinks up against this trach to allow for air movement up past the trach. When performing trach care, this particular trach does not have an inner cannula. It is during trach care that you will replace the inner cannula. Again, the inner cannula goes in the trach, and we keep this part as clean as possible in the trach, pinch, and attach to the trach. Pinch, and remove the trach. A trach care kit comes with a clean or sterile set of gloves. Since we already have our gloves on, we will set that aside. A clean cloth to place on the patient while we're cleaning. Suction, Q-tips, brush, and gauze, and fill time. So sterile water would go within our little basin. patient. This is what will most commonly be seen in the home care setting or else the hospital setting. We attach it to suction at -100 or whatever the home care sets up for your home suction. We have the thumb port, which blocks the suction and allows the suctioning to occur. The bag keeps suctioning clean, and this is the catheter in which we enter the trach. So to suction the patient, you uncover the catheter, send it down the trach without touching the catheter. You block with your thumb, and as you're blocking the suction, you pull the catheter out to suction your patient. That is how you suction a trach. The Q-tips are how we will clean the site. You will take the Q-tips, dip them in sterile water, and make sure to clean the flange. Throw it away. Make sure to clean the stoma site. And throw it away. And make sure that any dry secretions or blood is clean off of the trach. Next, we'll be applying the trach collar. What the trach collar does is it allows the trach to stay in place around the patient to secure the airway. It comes apart into two sections. One side, this Velcro piece comes up then. Slide it up underneath. Remember, glue is soft and helps prevent breakdown, so glue to patient always. You send the Velcro up through the flange. Velcro it down. You bring it around the neck. You take the other half of the trach collar, send it up through the other side of the trach. And then Velcro, this piece is Velcro, you Velcro it to itself so that the trach is secure. Okay, we are almost done with trach care. Once the trach is secure and we have it clean and we have the cuff appropriate for the patient situation, we take a split sponge and we want it underneath the trach. Easiest way to do it is bring the pilot balloon up and over, come underneath the trach collar, get under, bring it around the stoma site. Same on the other side, bring it up underneath the collar to keep that trach in place and secure. Up underneath, so that any possible dry secretions that might come past the trach out of the stoma are caught and we prevent breakdown. It is important with the trach collar and the sponge to make sure that all of the different parts are flat as to prevent breakdown. We don't want any wrinkles or creases to prevent breakdown. So that concludes how to perform trach care. Includes trach care. Some troubleshooting situations that might occur if, while doing trach care, always when changing the trach collar, keep a hand on the trach. When the trach collar is off, the trach is unsecure. Say a patient with a strong cough, we don't have our hand on, we could potentially lose the trach. So what can occur if we lose our trach? The patient has what's called a compromised airway. A compromised airway is an airway that is not secure and the patient is not ventilating or oxygenating the way we want them to, and the patient will have distress. So, for example, we'll say that we lost the trach. If the trach is on the patient, they coughed it out. If have a spare trach along with an obturator available with a trach patient at all times, whether it be in a hospital or home care setting. In a hospital setting, always have a new trach and an obturator available at the bedside. And in home care setting, always carry a spare trach, whether it be with a ventilator or else with their trach care kits or their oxygen, whatever modality they are with. This is so that if a trach does come out, we have a new clean trach we can place back in the patient. So, with the new trach, to place it back, you will make sure that the cuff is deflated as to avoid resistance. The obturator will be placed back into the trach so that we have it stiff and a blunted end to prevent tearing or trauma. Take the new trach and place it back in the patient, and it will be in a motion that goes with the anatomy. So you'll enter the stoma and you'll follow the anatomy till the flange is where it needs to be. And then take the obturator out because that will block the airway. Place the appropriate sized inner cannula so that we have a new patent airway available. Inflate the cuff if appropriate at this time. For the patient. So a few considerations would be what can be termed as a false trach. So while placing an emergent trach, it could go outside of the trachea, and that's what is called a false trach, and can cause air to go into the skin and muscle area. The best way to do that is to take the trach back out and find the best trach, and to contact emergency medical services to get specialized care with that. If increased air or nursing is called crepitus, contact an MD immediately if a trach comes out. Another considerations to consider: if secretions become dry with the trach, it can block off the trachea and cause what is called a mucus plug. The best way to treat a mucus plug within a trach is to take the inner cannula completely out and place a new one to clear. After that, instill normal saline and suction. Those are considerations. Also, be well aware of infection that could occur around the trach. That is why it's important to perform trach care in kids. That completes our lesson on trach care and troubleshooting with trach care. Thank you for your time.